Hi, I'm Dr. Markus Hill. Thank you for trusting us with your care. I'd like to talk a little about what to expect on the day of surgery. On the day of surgery, you need to come in with nothing to eat or drink for 8 hours prior to the surgery, and a driver that comes with you, stays with you the whole time, and takes you home afterwards. That's because we are going to make you asleep for the surgery. While sedated and during the surgery, you're just going to come in, get an IV in your arm, medications through it that make you relaxed and asleep, and when you're done with the surgery, we'll wake you up. During that time, we will place the implants into the bone. We may bone graft around the area, and then we're going to get everything all set up so that when you finish that day, you're ready to have an immediate arch of teeth. And almost every time we're able to put teeth on within 48 hours after the surgery that are screwed in, fully mounted, that feel as close to natural teeth as you can get. For after the surgery, we're going to have it be numb throughout that day, so you don't have to expect too much pain that day. It will slowly get sore over the next several days as the numbing medication wears off. There will be sutures in your mouth. They dissolve on their own, nothing you need to worry about with them. There will also likely be bone grafting around the implants, so little pieces or sand granules of bone may start to push their way through the gums or fall out. Don't worry about these. They will usually fall out on their own and are nothing to be stressed about. We'll likely give you an antibiotic to start the day before the surgery and continue for the week after the surgery to help minimize the risks of complications like infection. Bleeding is another possible complication, but it is a low risk if you don't normally have a bleeding problem, as we're able to close the gums around the area completely with this procedure. You will likely get swollen. It's important to ice that day and the next day to try and minimize your swelling. We'll also give you medications to help with this as well. Please try and stay on top of your pain management. I recommend you take non-steroidal anti-inflammatory drugs like ibuprofen if you're able to around the clock every 6 to 8 hours. This helps prevent not only the pain, but the swelling as well, and the inflammation that leads to more pain. Narcotic pain medications can be taken. We will prescribe these to take only if you need it. This whole process seems intimidating. It seems scary when you've never gone through it before. I highly encourage you to try and reach out to someone else who's been through it because it's so much easier than you imagine it to be. The surgery is easy. You get an IV, you're done. The next part with our digital workflow is not difficult. You'll come back in, the scan and all the work then afterwards is done outside your mouth, 3D printed, and all we have to do is screw it in afterwards. So don't be intimidated. The prosthesis, when it goes on top, the screwed in actual teeth, protects the wound. So after it goes in, your pain is less than it often is with just taking out teeth for someone else. We're happy to help you out in whatever we can. I hope this video answers a couple of your questions. If you have more questions, feel free to reach out with us and ask us in person. We're here to help you. Thanks again for trusting us with your care here at Smart Arches.